So this is going to be the first time I've subcubed at home completely alone. Third time, all in all. So you might fumble around with me a little bit or a lot. But I've got everything pretty much laid out. Some things I didn't open. I did wash my hands very good. The first thing I do, and I'm not a doctor or a nurse, I'm not training you how to do this by any means. I'm just letting you see what it's like to switch from IVIG to Subq. This is the concentrated hemoglobin. I do 75 grams twice a week, where I used to do, gosh, I don't know how much actually in the IVIG. But it took about 5.5 hours a day for 2 days in a row. And so this is a lot more user-friendly, I guess, for lack of a better word, life-friendly. The thing that I learned is stay somewhat sterile as possible. It's not as scary as the port to get an infection, since it goes straight from your port here. In case you don't have one, it's a lifesaver. Goes straight from the port to the heart. But the ends of everything is what's important, and you don't want to touch it. And you do want to go into this with clean hands. I swab the tip, and then after I immediately spike it. And you got to give it a little bit of force. Do each one of these. And I have them opened already, just so it's easier to grab and go after I've washed my hands really good. Some people use a lanacane lotion. It takes up to an hour before it begins to work. At least the directions say apply an hour before, but I've not used it as the needles are so small compared to what all I've been through. It doesn't seem to, I don't seem to need it. Take the end caps off. Now I have more grams than one of my syringes will hold. You might get a completely different kit, but this is what the pharmacy and the outpatient treatment center has gotten worked up for me. It kind of screws on. Get it nice and tight, turn it upside down. And this bottle is 50 grams, so I will end up filling this almost all the way up. Sometimes you'll get like little champagne bubbles in there. You don't have to be as worried about air as you do with a port or an IV. Now at the end of this, every donor counts, every drop counts. I pull it out just a little bit so I can get as much of the hemoglobin as possible. And I let it settle a little bit. And it's very sticky, so I try not to get it on me. But you want to do all the way up to the end. And if you have a little bit of bubble, that's okay. So there's one and done. Make sure it's in all the way. This one wasn't. Again, remove the tip. The smaller, the harder the bottle is. Screw it on. I start the small ones out, sliding it to the end. Ooh. I'm a little nervous, bear with me. So there's going to be a total of 25 in this syringe. I believe it's 20 and then 5 here. to go ahead and get the air out just until it begins to bubble, because I don't want it coming out when I respike it with the new bottle. Slight turn, pull it, pull it. You can see it's got the numbers really large, so it's easy to tell. And there I'm right at 25. Pull it out a little bit. There's a little more IG left. There we go. And a lot of this is retaining bubbles. So unscrew. Let it kind of surface. Little champagne bubbles. And then push out what's not needed. It's very messy. The most important tube is the flow rate tube. It helps control how much is being pushed into your belly at once. And this is what makes me nervous, because this is the first time by myself, but I think I got it. Okay. We want to prime the flow rate tube, which means push all the air out and prime it with the hemoglobin. So we're going to push this. I can't see it through the tubing since it's clear. The IG is clear. So I just wait till I see a nice bubble there right at the end. So that's primed. And then you have your 4 needle sets. It's to my understanding that the pharmacy usually use a 5 needle set, but they are out. So I've been working with this and it seems to be doing fine. I'm going to do it different than I've done it before. I had been using 2 4 needle sets per each infusion. But the pharmacy suggested just switching out the syringe and leave the needles in, which sounds like a great idea, and I'm on board, because the less poking after all we have been through, the better. I don't know how we can make this a little bit easier and less tangly. I don't think it's actually possible. So, and I don't even know what the tape is for. It might be for a good reason and I just wasn't taught. Who knows? Okay, so you got your end of the 4 needle set here. You've got your tubing connected, and my nurse did not teach me to do this, but I'm going to remove the cap on each end. Make sure your hands are washed. You don't want to go poking around at the end of the needles, and try not to touch them. It's very important to stay sanitary. But I'm going to prime it. Push out the air and push through some fluid almost to the end of the needle. I don't want it to come all the way out before it's attached to my skin, because 1, I don't want to waste any, and 2, I don't want it to burn me. It stings a little bit, I've been told. Well, inexperienced. So since I can't see it, I'm gonna guess it's not very much. So yeah, I can't see it. It's not real easy to push either. Afraid to do it fast. It's gonna fly everywhere. Maybe I'm clamped down too. No? It's just the flow rate tube won't let me prime it. clamped? No. Okay, so maybe I won't prime it like they taught me. It's just a little air in the belly. It's not going to hurt you. So you've got your needles. Be very, very careful. You want to have your Tegaderm strips ready. I have 4 out. And I'm going to get the box of alcohol wipes open. That way, if I need more, I have more. I'm so excited this time I'm only doing 4 pokes instead of 6. Okay, so that's 4 pads. I go ahead and clean with the right hand. Grab it with the left. I wait a little bit for it to dry. Don't want it to sting from the alcohol. I think I might have done that a little bit too far out, so I will need a 3rd one. This should be good, maybe a little bit lower. I was told to stay 2 inches from the belly button and not too far off on the side. Okay, so here we go. It doesn't hurt as much as accessing a port or getting an IV. I honestly barely feel it, but I don't want to say that you won't, because I've had a tummy tuck as well as a C-section, so my nerve endings are a little bit desensitized. I do have some sunless tan on, so I'm trying to get it extra clean. Okay. If you drop a needle on the floor, sneeze on it, don't use it. Your pharmacy would rather you call and ask them for more needles and more supplies than you risk contaminating or contaminating yourself or getting an infection in your skin. Almost done. After this one, I only have 2 more to go. Yeah, I am nervous. The house is empty though. The kids aren't here. That other needle, I'm keeping an eye on it. It's still airborne. It's not touching anything. Rods, so bending over is a little bit hard for me. I think if I didn't have that and I was male or not as busty, it would be a little bit easier for me to see as well. You guys doing okay? I know it's a lot, but once you do it a time or 2, and once you start it, you'll be so thankful that you're not tied up to the IV pole for 6.5 hours, or, you know, I've heard when I first started, it was 8 all in one day, and I did not like it. Okay. So this is the best that I know how to do, the best that I was taught. I started off with the smaller ones so it would go quicker, and I could show you how to transfer, hopefully. That's absolutely new to me and was described over the phone. So I hope you get better care than I do. Okay, here that's as far back as I can draw it. By the shape you can tell which way you want your syringe to go. It's easy, put in and turn. And then you simply screw this back in all the way. And this Subq infuser pump will do all the work along with the flow rate. Set, and it should be going. I'll be able to feel it here in just a second in my tummy. Yep. It's, I don't want to say a sting, but you can definitely feel, and there's a slight sting. But don't be a pansy. It's way easier than it looks. I mean, it looks pretty scary, but it's better than the IV. And you can put this in your purse, pull down your tank top, and run to the gas station, get you some coffee. So I'm going to clean up just a little bit between the two different syringes. If you have any questions, comment below, and I'll check in about a week and see if I can't answer any of your questions, or if you have suggestions on how to do things easier, by all means, let me know. That would be great. I know that a lot of people do pull back when they inject the needles after they're all injected, and see if they're in a vein. My nurse said that she doesn't do that, so I wasn't taught how to do that. It was explained to me in a Facebook message how to do that. However, I didn't want to try it on my own. I was scared. Not if I'm going to record it. So, just put that down there. You do end up with a bit of pile of trash. I was putting it in my extra sharps box, but the one I'm using is filled up really quick with the 4 set. So I might end up using this today because I don't want to poke myself. I've got a trash bag right there. Actually not moving. Maybe it is. This is why if they leave you on the second visit, I think you should fire that nurse. But I started off with 25 grams and I can feel it. I'm getting serious. Putting my hair up. And nervous energy. While this is doing its thing, let me put my glasses back on so I can keep an eye on. We started at 25 and it's down to 20. So it's going, I guess. It's just going slow. Something I thought that's really beautiful about the hemoglobin is how it's kind of opaque in the bubbles. And I learned that each lot, well, this is with, what brand was I using? Gamunex, which I've been on Gamunex for 4 or 5-ish years, Gamunex C, and it takes 3,000 people to donate plasma to create a lot. And each bottle, for example, that I have here today, has the lot numbers on them. And these come from different lots. So I would think that this is more concentrated and probably more than 3,000 per lot. But today we're looking at 3 different lots. So that's 9,000 different donors. So asking your friends to donate and putting it on social media, finding your donation centers and letting people know is really an awesome thing to do. One, it puts here in my area, I'm in mid-Missouri, the closest place is Columbia, Missouri, and they put $60 in your pocket. And we are on a shortage of Gamunex, I know, so I think that's why I'm on this little brand here. Also, while we're talking about supplies, mine get shipped to me, and this is what the lanacane lotion looks like. I've not opened it, don't have a reason to use it. I might try it for nerve pain or something, but if you can see the pump, we're down past 20 grams, about 18, so it is moving. It's just taking longer than I remember, I guess because I'm being recorded and I don't have anything to talk about besides this. Oh, I guess I could show you my flowers in the back here. My friend bought those for me. I guess just because it was, can you see them? A treatment day, he said. They're really pretty. I need a better vase. Vase. He's a sweetheart. My kids, this scares them. They're 13 and 14, and this scares them more than my intravenous hemoglobin. I think that's because they're more used to seeing people with an IV pump, and I've been doing that consistently for 4 years, every 3 weeks. And, you know, my son says it was the size of the syringe that scared him. But even though that is a lot of fluid, that doesn't equate to the size needle that I'm using. They're so small, I can barely feel it. So I do them, I'm gonna do it today, which is Tuesday, and then again on Thursday. So every Tuesday and Thursday. It does take a couple days to absorb through the stomach. I might have been a little bit shy about the idea, to be honest, because of thinking about 75 grams of fluid sitting under my tummy, where I've taken such as good of care of my body as I can. Was kind of disheartening, and the thought of 4 pokes, well, I was told 5, but they didn't have the 5 needle, just wasn't ready. But my nurse quit on me, and she's now working part-time instead of full-time, and has gotten married, and she's just having a great life, and talked about Subq-ing, and that's what got me to do this. I figured if I was going to lose her, I don't want to replace her, and I'll replace her with this pump. But there's no replacement for someone here with you while you're doing it. So if you're watching this for a family member or a friend, the best thing you could do during treatment is just to hang out with them. I've had friends worry about meals, and send the flowers. That was a nice gesture. I didn't want him to stay because he's going through a breakup and going through a lot, and I don't want to add to his plate. I think seeing a friend like this is something that the friend should come to you and say, hey, do you want me to sit with you during treatment day? But I wouldn't ask, because if it's a little too much for my kids and they've been through all that we have been through together, then I kind of realize this might be more than what everybody can handle. Maybe seeing it a time or two is better and it won't freak them out. Okay, we're right at 10 grams. that's going good. I haven't taken the spike out of this, only because the hemoglobin is real sticky. They put it with a sugar-based soluble, so when it dries or when it's on the countertop or my styrofoam shipping lid here, it dries up really quick, and the last thing I want to do is to figure out how to clean the tip of this out so that the fluid could come out as well. I'm running out of things to say. I don't use gloves with this. I did practice wearing the mask for my IG through the port. I did not wear a mask when it was intravenously, but after a couple years, I flat out didn't have any veins left, and I realized that even though I was tough, it was something nurses don't generally like or enjoy or want to come and have their day filled with hurting people over and over and over again to get the treatment that they need. It wears on them as much, if not more, than it does on our own selves. So when a nurse kept apologizing and I told her not to apologize, and she looked at me and she said, "No, I'm sorry, this is stressful for me too." I realized, let me swallow my pride, even though I can handle the pain and tough it out. Let me go ahead and get this port, and it was the best decision besides going to Subq that I have ever made. It was such an easy surgery. My first doctor, he didn't do that great a job. He didn't take into consideration the weight of my breast, and the second surgeon, she put it in very taut so it doesn't move. I can go braless. It's just much easier and comfortable, and the other one shifted and shot nerve pain all the way down to my hand. It was so hard to focus driving, and finally on day 3 I said, take it out. So they put the new one in, and I've been doing much better with it. I'm also trying to keep an eye on this thing here. As far as recovery time for the port, I'd say, I know I quit taking the hydrocodone pain medication at least 2 days after surgery, and then I just kind of pampered it, and I didn't go on any great big kayaking waterfall adventures or no parasailing or anything like that. One thing that's common, especially with people that get the port suddenly and they know they might not make it, like cancer patients, I've learned a staple complaint. I hate to say complaint, but I guess that's the only word I can come up with. A staple complaint is that they don't get to shoot. I have gone out with a friend of mine and shot clay with it. I just put it off a little bit further out to the right, and then I did shoot left-handed, which was very awkward, and I shot it like I'm right-handed, but I just shot it from over here. But I did shoot, and I did fine with it. But that doesn't mean that I suggest it. In fact, probably don't do that. I don't recommend it. And what I also like about the subcuing is you don't have an embarrassing pump laying around your house, and you don't have to answer all these questions when people see the pump or the IV pole. But I can do this in the middle of the night after I put my kids in bed, when they go back to school. Like, they might completely forget that I even do these, and that's my goal. While I've still got you here, I'm going to show you, I don't know if you can see them yet or not, but it does leave fluid, of course, under your tummy, and they look like little pancakes under your skin. And so I'll have 4 of them from today, and it does feel like there's fluid when you're walking around. there's a little extra jiggle in the wiggle, but other than that, I've not had any bruising, any problems being uncomfortable in my belly, sleeping, everything's been fine. I mean, I didn't, the last treatment last week, after both of them, I didn't go out jogging or anything extraordinary, but I was able to hang out with my kids, and I believe both days I made 2 meals, so it's so much easier. And it literally, I wish I had my purse, but it fits perfect in my purse. Don't ask me why. I may have gone to the grocery store. When my nurse left me, I took off. But yeah, it fits right in there, and you can go and pull down your shirt, and nobody even looked at me or had any idea. So that was nice. Almost done. I'm curious to see if there's going to be, every reaction has a reaction, so it's pushing this way, and when it's done, I wonder if I untie it, if it's going to drip out a little bit. It probably will, so I'll do it over this. I was told to wait till you hear the click. I only heard it the very first time, so I just pay attention to it. Show you, it's down to about 3 grams. I don't know if you can even see that. This is just my iPhone camera, but it's down to 3 grams. And for those of you that do donate, while I've got the time, let me say thank you. Thank you so very, very, very much. It means the world to me. Hemoglobin has kept my own immune system, as ferocious as it is, from attacking my own body and myelin sheathing around my nerve endings. And it's kept me walking and kept me, I do have a little bit of trouble swallowing, but without you, I wouldn't be the good mama that I am. I mean, I'd still be a good mom, but not able to do as much. Okay, I think we're done here. And I don't know how they want me to do this, but I'm gonna totally just disconnect. Unscrew. Righty-tighty, lefty-loosey. Now I'm ready to take. Oh yeah, it screws. See, I'm nervous. It's going to take me a little while to get a routine. Okay. Screw that back. You want to line it. Oh, it won't go back any further. You got to pull this all the way back every time. As far as it will go. Put it in there, and of course that lines up with this. You just kind of screw it. It seems so unstable, but it works. There you go. Good suggestion, when you do change it, clamp down the flow rate too. That's what I forgot to do. Probably along with many other things. But this is Rebecca, and this is my life. And if it's yours now, we can do this together. Take care.